Hello and welcome to our YouTube video on bipolar disorder, symptoms and treatment options. Bipolar disorder, also known as manic depressive illness, is a mental health condition that affects an individual's mood, energy, activity levels, and ability to function in their daily life. According to the World Health Organization, WHO, bipolar disorder affects approximately 1 to 2% of the global population, making it one of the most common mental health disorders worldwide. It affects both men and women equally, and can develop at any age, although it usually appears in late adolescence or early adulthood. Bipolar disorder has a long and complex history, and has been viewed in various ways over time. In the past, it was often misunderstood or misdiagnosed as other conditions such as schizophrenia or depression. It was not until the 19th century that the concept of bipolar disorder began to emerge, and it wasn't until the 20th century that it was recognized as a distinct psychiatric disorder. It is important to understand bipolar disorder because it can have a significant impact on an individual's life, including their relationships, work, and overall well-being. It is also a highly treatable condition, and with proper diagnosis and treatment, individuals with bipolar disorder can lead productive and fulfilling lives. In the rest of this video, we will explore the symptoms of bipolar disorder, the causes and risk factors, treatment options, and strategies for living with bipolar disorder. Symptoms of bipolar disorder. Bipolar disorder is characterized by alternating episodes of mania or hypomania and depression. These episodes can last for days, weeks, or even months, and can vary in intensity and frequency. Manic episodes are characterized by a distinct period of abnormally elevated or irritable mood, increased energy, decreased need for sleep, racing thoughts, grandiosity, and impulsive behavior. Some common symptoms of mania include feeling euphoric or excessively happy, irritability or agitation, increased talkativeness or rapid speech, racing thoughts or flights of ideas, decreased need for sleep, increased activity levels or restlessness, engaging in high-risk behaviors, such as spending sprees, drug use, or reckless driving, delusions of grandeur or inflated sense of self-importance. On the other hand, depressive episodes are characterized by a distinct period of low mood, loss of interest or pleasure in activities, feelings of worthlessness or guilt, and changes in appetite or sleep patterns. Some common symptoms of depression include feelings of sadness, emptiness, or hopelessness, loss of interest or pleasure in activities, changes in appetite or weight, insomnia or hypersomnia, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, suicidal thoughts or behaviors. In addition to manic and depressive episodes, individuals with bipolar disorder may experience hypomanic or mixed episodes. Hypomanic episodes are similar to manic episodes, but are less severe and do not cause significant impairment in social or occupational functioning. Mixed episodes involve symptoms of both mania and depression and can be particularly challenging to manage. It's important to note that symptoms of bipolar disorder can differ between individuals and may present differently in different people. It's also possible for individuals to experience symptoms of bipolar disorder without experiencing full manic or depressive episodes. A proper diagnosis by a mental health professional is critical to understanding and treating bipolar disorder. Causes and risk factors of bipolar disorder. The causes of bipolar disorder are not yet fully understood, but research suggests that it is likely caused by a combination of genetic, environmental, and neurobiological factors. Genetic factors play a significant role in the development of bipolar disorder. Studies have shown that individuals with a family history of bipolar disorder are more likely to develop the condition than those without such a history. It's believed that multiple genes contribute to the development of bipolar disorder, and that certain gene variations may increase an individual's susceptibility to the condition. Environmental factors can also contribute to the development of bipolar disorder. Traumatic life events, such as physical or emotional abuse, neglect, or the loss of a loved one, can trigger the onset of bipolar disorder in some individuals. Other factors such as chronic stress, substance abuse, and sleep disturbances can also play a role in the development of the condition. Research has also identified neurobiological factors that contribute to the development of bipolar disorder. Changes in brain chemistry, specifically imbalances in neurotransmitters such as dopamine, serotonin, and norepinephrine, have been linked to the onset of bipolar disorder. Structural abnormalities in the brain, such as changes in the size or activity of certain brain regions, have also been observed in individuals with bipolar disorder. Substance abuse, particularly the use of stimulants or drugs that affect the central nervous system, can trigger manic or depressive episodes in individuals with bipolar disorder. Substance abuse can also worsen symptoms and interfere with treatment. Diagnosis of bipolar disorder typically involves a comprehensive evaluation by a mental health professional, such as a psychiatrist or psychologist. The evaluation may involve a physical examination, laboratory tests to rule out other medical conditions, and a thorough assessment of symptoms and family history. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provides specific criteria for the diagnosis of bipolar disorder, which include the presence of manic, hypomanic, or depressive episodes. A proper diagnosis is critical to effective treatment and management of bipolar disorder. Treatment options for bipolar disorder. Effective treatment for bipolar disorder typically involves a combination of medications, psychotherapy, and lifestyle changes. Alternative and complementary treatments may also be considered, but should be discussed with a healthcare provider before being pursued. Medications are a cornerstone of bipolar disorder treatment. Mood stabilizers such as lithium, valproic acid, and lamotrigine are commonly prescribed to prevent or manage manic and depressive episodes. Antipsychotic medications may also be prescribed to treat symptoms of mania or psychosis. Some individuals may also benefit from antidepressant medications, although they should be used with caution due to the risk of triggering manic episodes. Psychotherapy, specifically cognitive behavioral therapy, CBT, and interpersonal and social rhythm therapy, CBT, can also be an effective treatment for bipolar disorder. CBT can help individuals identify and challenge negative thought patterns and behaviors that contribute to symptoms of depression or anxiety, while CBT focuses on stabilizing daily routines and managing interpersonal relationships to reduce the risk of mood episodes. Alternative and complementary treatments, such as acupuncture, meditation, and herbal supplements, may also be considered as part of a comprehensive treatment plan. However, the efficacy of these treatments is not well established and they should not be used as a substitute for evidence-based treatments. Lifestyle changes and self-care are also important components of bipolar disorder treatment. Regular exercise, a healthy diet, and adequate sleep can help stabilize mood and reduce the risk of mood episodes. Self-monitoring, such as keeping a mood diary, can also help individuals identify triggers for mood episodes and track treatment progress. It's important to note that bipolar disorder is a chronic condition that requires ongoing treatment and management. With proper treatment and self-care, individuals with bipolar disorder can lead healthy and fulfilling lives. Regular monitoring by a mental health professional is critical to ensure that treatment remains effective and to adjust treatment as needed. Living with bipolar disorder. Living with bipolar disorder can be challenging, but with the right strategies and support, individuals can learn to manage their symptoms and lead fulfilling lives. Coping strategies for individuals with bipolar disorder may include learning about the condition and developing a treatment plan with a mental health professional, building a support network of family, friends, and healthcare providers, practicing self-care, such as maintaining a healthy lifestyle, managing stress, and getting enough sleep, developing a crisis plan to manage mood episodes, seeking support from peer support groups or online communities. Family and friends can also play an important role in supporting individuals with bipolar disorder. This may involve providing emotional support, helping with daily tasks during mood episodes, and encouraging adherence to treatment. Education about bipolar disorder can also help family and friends better understand the condition and how to support their loved ones. Workplace accommodations may also be necessary for individuals with bipolar disorder. This may include flexible work schedules, job modifications, and access to mental health resources such as an employee assistance program. It's important for individuals to communicate their needs with their employer and request accommodations as needed. Stigma and advocacy are also important issues for individuals with bipolar disorder. Stigma can create barriers to treatment and support, and advocacy efforts can help raise awareness and reduce stigma. Examples of advocacy efforts may include speaking out about the condition, participating in research studies, and supporting mental health organizations. There are many success stories and examples of individuals living with bipolar disorder who have learned to manage their symptoms and achieve their goals. Celebrities such as Demi Lovato and Mariah Carey have spoken publicly about their experiences with bipolar disorder, and organizations such as the International Bipolar Foundation feature personal stories of individuals living with the condition. Overall, with the right strategies and support, individuals with bipolar disorder can lead fulfilling and productive lives. Bipolar disorder is a complex condition that can have a significant impact on an individual's life. Understanding the symptoms, causes, and treatment options is key to managing the condition effectively. It's important to seek help and treatment from a mental health professional, and to develop a comprehensive treatment plan that includes medication, psychotherapy, and self-care. While living with bipolar disorder can be challenging, there is hope for the future. Ongoing research into the causes and treatments of bipolar disorder is leading to new insights and therapies that can improve the lives of individuals with the condition. With the right treatment and support, individuals with bipolar disorder can lead fulfilling and productive lives. If you or a loved one is struggling with bipolar disorder, don't hesitate to seek help. A mental health professional can help develop a treatment plan that is tailored to your individual needs and support you in managing the condition. Remember, there is hope for the future, and with the right strategies and support, individuals with bipolar disorder can thrive.